Hello again. Health Minister Dr. Zweli Mkhize says the peak of COVID-19 infections is upon us. And with this comes the increasing need for more beds to be available for patients. Dr. Mkhize said that more field hospital beds needed to be prioritized. South Africa is currently recording over 12,000 new cases a day. That's according to President Cyril Rampahosa's address last night. So what's the outlook on beds? We try and find out now from Wits School of Governance's Professor Alex van Heever. Thank you very much, Professor van Heever, for joining us this afternoon. So as we understand it, Gauteng has 8,301 beds, and there could be a need for 500,000 more by the end of the month. What do you perceive is going on in the province?
Well, I think that there is if the trajectory keeps going up like this, we will very clearly run out of capacity. And so there is a need to address both the new infection levels as well as to provide for additional capacity. Gauteng does have more beds than any other province in South Africa, including more private sector beds, significantly more in terms of critical care beds than the public sector. So it does have some capacity, but it's definitely going to need to have workable, functional field hospital beds available. That should really have been developed by now.
You mentioned that should have already been developed by now. When we went into lockdown, some assume that perhaps this was to buy a little bit more time. Do you think we're on the back foot here?
I think we are. Unfortunately, the Nasrec facility that's been created doesn't really have functional beds. They're not really equivalent to general ward beds, and they don't have an oxygen supply. I know that there is an urgent process underway to try and service them and to make them available as potential hospital beds, but you also need to have worked out a personnel strategy as well. Western Cape had a full facility, up to a month and a half ago. So when it began a sort of a surge in that province, they had fully functional general ward equivalent beds with oxygen supplied, and they could put staff into them. So it's unclear as to why the field hospital arrangements in Gauteng are so far behind.
It's not just about beds, is it? The President also mentioning yesterday the issue of ventilators and oxygen as well at these facilities.
Yeah, so ventilators require trained staff, so you do need trained nurses as well. And so how one would organize the services to increase the number of nurses at the front end is clearly a major consideration going forward. It's unclear how that is going to be organized. In other countries, they have attempted to achieve this objective by restructuring some of the functions within the health service to free up trained nurses for this frontline activity, having lesser trained people in the more routine tasks that nurses would carry out, and then free up the more highly trained nurses for this type of work. So ventilators on their own is not going to be sufficient without oxygen and or trained nurses and staff.
How would you characterize Gauteng's treatment strategy?
Chaotic. It's unclear to me why we are on the back foot at this stage. I mean, there is constant reference to having been expecting this. And I would argue that I certainly wasn't expecting it. You were hoping that the prevention strategy, for which we had a lot of time to prepare, would have an impact on the trajectory. But the steep rise that we've seen is much steeper and much faster than anybody's expected, and therefore it's shocked the system. But the beds at least should have been in place for a significant number of additional beds, and there should also have been proper arrangements with the private sector in place as well to use them for surge capacity. But it's important to note that the private sector itself is going to run short of beds because medical scheme patients, COVID patients, are increasing all the time in the private sector, and so their bed capacity is also under huge pressure.
And that, I would assume, means whether you have a medical aid or not, you could find yourself in a very precarious situation.
That's right. What will potentially have to happen is that a lot of people who would have been in critical care will have to be treated in general ward if it carries on like this. But if we've at least got decent oxygen supplied to the beds and we've got reasonable sort of staffing, we might be able to manage it. But I am very concerned at the speed with which the sort of new infections are increasing. That is a serious concern. This is a much steeper rise than occurred in the Western Cape, and essentially means that we've got to rethink our prevention strategy in Gauteng. It's got to become a lot more aggressive than it's been to date.
Your reaction, perhaps, and we are going to speak to the organization looking at alcohol, but your reaction to the rebanning of alcohol, as it has been explained, it puts pressure on the healthcare system.
Yeah, so there is a legitimate rationale for a prohibition on alcohol. It does we have a serious problem in South Africa with trauma-related cases in hospital, and I would differentiate the alcohol issue from the tobacco issue. But the problem with both of those, these general prohibitions create a problem that they get circumvented pretty easily in due course. So the longer they're in place, the more people learn how to get around them. And so you're very likely to have illicit alcohol supplies occurring within society very quickly. So I'm not sure how long a generalized prohibition will be successful in terms of its core objective, which is reducing trauma. I noted that the minister was referring to people behaving badly and not socially distancing, etc. I'm not sure that that is the core reason for the alcohol ban, but I think that it only works to the extent that you are able to successfully circumscribe the use of alcohol, and I'm not sure that that will be sustained for a very long period.
Finally, for us, a number of terms, we have been introduced to a number of terms since the beginning of the outbreak. When we talk about hospital bed dashboard, what are we referring to?
Well, what you want to do is to know exactly where beds are available in real time, because you're trying to refer patients who are becoming critical, for instance. So you need to be able to shift them up and down levels of care. And in many cases, this might be between facilities. So it's not just up and down in a particular hospital, but between hospitals and between a hospital and a field hospital. So you want a real-time dashboard telling you exactly where patients, which beds are full where, so that as you're triaging or you make immediate decisions about patients, you know exactly where to send them, and you don't have them wandering around in an ambulance wandering around trying to find a hospital bed.
Professor Alex van der Heever is from the Wits School of Governance. Thank you very much for your time this afternoon.